important to have a PrEP in Black America Summit because we need a platform, a forum for us that is by us. We have health advocates, we have researchers that are doing the work. However, we are not the ones that are sitting at the table. We are not the ones being put in the position where we can advocate for ourselves. Not only that, we are in our communities doing the work. What does that look like? That looks like us telling our brothers, our sisters, our friends, and our cousins what is available to us. Not only if we are choosing to have or engage in sexual activities, but what are those tools that help us preventing us from contracting the HIV virus? We see that there are resources available for our other counterparts, but there is nothing available for us. A lot of times we need to see it and hear it and to know that these resources are available to us, but we can only advocate for that if we see someone who is like us.
Hi, my name is Abraham Johnson, Senior Communication Officer for Treatment Action Group. The PrEP in Black America Summit is so important because the needs of Black people often go unmet, whether we're talking about PrEP, whether we're talking about COVID-19, access to vaccines, and the PrEP in Black America Summit is an opportunity for us to get to the root of the issue and come up with critical solutions to make sure that PrEP is accessible in Black communities. So this was a chance for us to really put our brains together and come up with strategies, key recommendations to make PrEP available for Black communities.
As a person that's been living with HIV for the last 17 years, I've had the pleasure, I've had the honor, and I've had the need of the Ryan White program. That would be amazing if someone who was HIV negative had the things that they needed to keep them HIV negative. That's why we need a national program. There are people who are in need of something that will keep them from this life thing that takes away from them. And so it's important that we have a program that undergirds the cost. So it's important. We need the money. We need the resources.
Federal resources for PrEP will not only reduce the HIV stigma, but also it would allow our communities to have better preventative measures. It is so important for the Black community to understand what PrEP is, because as it relates now, Black America only understand that PrEP is for the LGBT community, which that is such a great misnomer. So in order to have a global PrEP campaign, it is so important so we can build collaboration as well as to ensure that our communities understand what safe sex is, and that includes not just intervention measures, but also preventative measures as well.
One of the reasons that we need a federally funded national PrEP program is because regardless of what city, what state, what region you reside in, you should be able to get access to PrEP. It shouldn't matter if your state has Medicaid expansion or not. We know that PrEP is very effective at preventing HIV, and unfortunately, only 9% of Black people who can benefit from PrEP are able to actually access it. So we definitely need a robust change in the way we approach PrEP. And that starts with a federally funded national PrEP program to cover labs and medication for uninsured individuals, as well as expanding provider knowledge and access to providers through programs like teleprep.
Hi, my name is Kenesha Harris, Executive Director of Founder Light Advocacy and LGBTQ Resource Center, and I'm also representing my sorority, Kappa Alpha Sigma Sorority Incorporated. And one of the things that I've learned today is just like trying to bring more people in, and also telling our healthcare providers, our advocates, our organizers, how we need to get into our communities, and also bringing those numbers up into actually like talking about PrEP, getting people to take PrEP, getting people to know that like there is an epidemic still going on, and we need to protect ourselves, and we need to be here for our community.